Good afternoon. First of all, I would like to thank the organizers for giving me the opportunity to share my thoughts. I think you all know that how nurses are very significant in the healthcare delivery system. The nurses are the only personnel working with the patients 24 into 7 and to take care of the physical, psychological needs and technological interventions, all the things which have to be taken by the nurses in the healthcare delivery system. I think the new technology which has come definitely which has helped us to provide the proficient care. And how important as a President of the Indian Nursing Council when we sent a proposal to the Government of India for amending the Act. And one of the things which we submitted to the ministry was the patient's representative should be there in the commission. So that's the, I think, one of the things which has been accepted by the government in the new National Nursing and Midwifery Commission. The patient advocates are going to be there in one of the member of the commission, which will help us to frame some of the policies for the patient needs. So in that perspective, I am very happy that the patients are the key personnel which need to be involved in the nursing care plan at the institution. I think another important point which was told that how especially with the technology which is coming up, the quality of the patient care and quality of the nursing education to improve. Simulation as a method of teaching which has been now we have improved, and we have skill labs, and we have developed the state-of-the-art simulation technology in Gurgaon, so that all the faculties need to be trained in the simulation as a method of teaching, which is going to improve the quality of the nursing education. And I think in the 2020, WHO made an International Year of the Nurse and Midwife, and the DG WHO made a statement that you cannot achieve the universal health coverage without the nurses. That is the significance of how the nurses are important in the healthcare delivery system. So in that perspective, the state of the 2020 brought out WHO State of the World Nursing Report 2020. In that 4 themes were there. I think I would like to reiterate for the policymakers, is one of the point which was told to me is the investment. I think one of the theme which was involved in that State of the World Nursing Report is the investment. The investment is not coming to the nursing education. That is not only for India, it has been the prescription to the globally. The number 2 is the creation of the nursing positions. Unless you have a optimum nurse-patient ratio, you will not be able to provide the quality of the patient care. You can't take in a district hospital 1 nurse for the 30 to 40, and sometimes in a district hospital only 3 or 4 nurses in the whole district hospital. So therefore, the report says that the creation of the nursing position. Number 3, the leadership. I think the nurses are the key collaborators with the various specialities. They can work effectively in the team as a team member. So the leadership is one of the theme which has been reflected. And the 4th is the service delivery. The service delivery means all the necessary equipments and supplies required for providing the quality of the nursing care. So in that perspective, I think the nurses, I think our earlier chair made a mention that how the nurses are poorly paid. And whereas the working condition in the government sector is very good, whereas in the private sector the working conditions are not satisfactory. In that perspective, Supreme Court has gave a guideline that what should be the minimum salary to be given to the nurses working in the private sector, which is still yet to be implemented by the Government of India, in spite of that Government of India giving instruction to all the state governments. So therefore, these are to provide the quality. Upskilling is very important. The quality of the nursing care has to be there, because the day in and day out, science and technology which is coming up, so the nurses need to be trained in the continuing education. And the nursing organization at the state level, nurses are not involved in the policy makers. Once the nurses are not involved in the policy maker, nurses are the only people are the patient advocates. The patient safety is in the hands of the nurses. So therefore, upskilling and also involving the nurses in the policy making is going to make an impact in the patient outcomes. Thank you very much.